Hey y'all, it's me. I'm back for my second part of my series on peripheral neuropathy, polyperipheral neuropathy. I was going to try to do this going from the head to the toe with my symptoms, going from my head all the way to my toes and the symptoms I've had in all those areas. Sorry, I keep hitting this stand and it keeps moving my camera. But my symptoms started, like I said, in 2003. If you didn't see the first video, go back to my YouTube page and you can see on the first video, we discussed a little bit about what peripheral neuropathy was, and the different nerve areas in the symptoms that you can have with peripheral. Well, I have polyperipheral neuropathy. So I have different areas of the nerves that do different things that are misfunctioning. So in the beginning, I told you I developed optic neuritis, which is the inflammation of the optic nerve. And I was diagnosed with that twice in 2003. I also had symptoms like vertigo, where if you're sitting in a room and the room seems to just start spinning out of nowhere. I had that whether I was sitting, whether I was lying, whether I was standing. When I was standing, it got worse. So I tried not to stand when I developed that. I tried to lay down, but it seemed like when I would lay down, that would get much worse. And some people have vertigo where it feels like the room is spinning, spinning, spinning. Mine didn't do that. Mine sort of went back and forth, back and forth, back and forth, back and forth, back and forth real fast like that. So I had to deal with that for quite a while. I still have bouts with vertigo, but my doctor does give me something to treat that. It's called meclizine, and I take that as needed whenever I have those problems with the vertigo. So after that, I developed difficulty with trying to say the words that I was thinking in my mind. I guess it would be similar to something like a stroke patient does, where they know what they're trying to say, but they can't quite form the words to say it. And I dealt with that for quite a while. That is a difficulty in itself when you're working in the nursing field and you're trying to talk to patients and you're trying to give them, information on their illnesses and their diseases, and you can't quite get the words out. So it's quite a stumbling block when you're in any type of working field anyway. And then I had problems also with my vision. With the optic neuritis, it caused that blind spot in my eye. But that got better and I never dealt with that again. But like I said, I still deal with the difficulty speaking, sometimes trying to say what I want to say. So on these videos, you may see me trying to form a word or it may come out wrong or something like that. It's very seldom that I develop that, but it comes and it goes. And I feel like it's just like a subconscious thing now, where I get a stumbling block and don't know what I'm really trying to say. But I have done better with that. I haven't had problems with that. I also had real bad depression. I told you about that. Anytime I think when you're dealing with a chronic illness that is unseen to the naked eye, you can have sometimes problems with depression because other people can't see what you're going through and they don't quite understand what you're going through because they're not going through it themselves. So it can be really hard on you and it can cause you to have some type of depression. And like I said, you really need, if you're really in a severe depression, you really need to get some help. Talk to someone. If you can't find anyone to talk to, go seek professional help. Sometimes your friends and family won't understand what you're going through because they're not going through it themselves. Sometimes if they see some symptoms that you're going to, if you're telling them you're having pain, if you're telling them you're having problems getting rid of this or getting rid of that, and you're having these symptoms, that symptoms, sometimes you can find family members who are sympathetic. Other times you just think you have family members who think you're just complaining just to complain. But one thing you have to understand about chronic illness or chronic diseases is that just because you can't see it or other people can't see it on you, that it is a real thing. And I, as someone who worked in the medical profession before all of this began happening to me, I would say, how can somebody be in that much pain and nothing helps them? Until I developed this blind illness that no one can see or I can see and don't quite understand it. And a lot of times you also deal with people who think you're drug seeking or just seeking attention, and they won't pay you any attention. There's a lot of medical professionals who will think you're seeking or you're just complaining just to complain, because no one, if you haven't been in this type of illness or haven't had this type of illness, then you really don't understand it. And I myself was guilty of that. I will be the first one to say that I was guilty of that. But now I understand. So that's what sort of why I want to do these videos, to see if this would help anyone else who may be going through something like this. I am, like I said, not a mental health professional. I am not a medical doctor. I don't come on to pretend to be anything. I don't come on to have, to look a certain way. I just want to tell this story, get it out there for those who don't understand the things that happens when you're going through chronic illnesses. I also developed a short-term hearing loss. Well, it wasn't quite a hearing loss. My doctor that I went to told me that I had hearing loss in both ears. Now, I didn't know if it had anything to do with what I was going through, but I know that it developed after I started having all of these problems, all of these symptoms. So I just had that going on. What else did I have going on? I had difficulty swallowing sometimes. And it was little small things like water would choke me. Any type of meats I ate would choke me, no matter how small they were, how small the bites were, and I chewed them well, I would still get choked up. And sometimes now I can still have that sensation, like at night when I'm in bed. I can wake myself up in the middle of the night choking. And I don't have problems with like sleep apnea or anything like that. I've been tested for that. And I don't have those issues. I don't have use of a CPAP machine or anything like that. So I would just take it as that it was something that was going on with the nerve issues. And when you have a misfunction of your nerve endings, that can cause all kinds of problems. So that is my story for today, or not my story, but just telling you what I went through, like from an upper part of my body, from my head down to my neck, those issues. Now, I do have other symptoms coming up in my next story, so stay tuned for that, and I will talk with y'all later. Thank you for listening.